Welcome dear students, I am Dr. Pratyusha and in this video let us learn about granulomatous diseases of the nose. So in the first place, what is a granuloma? While we are learning about all the granulomatous diseases, let us first understand what is a granuloma. Granuloma is a tumor-like mass. Made up of what? Granulation tissue. It consists of actively growing fibroblasts. There are fibroblasts. Along with fibroblasts, we also have budding capillaries. And why are all these present? Actively growing fibroblasts, capillary buds, everything because of a chronic inflammatory process. So all these granulomatous diseases consist of chronic inflammation. So let me summarize it again for you. Granuloma is a tumor-like mass. It consists of granulation tissue which has actively growing fibroblasts and budding capillaries due to chronic inflammatory process. Now there are various types of granulomatous diseases. There is a classification for that based on the etiology and type. I will write that down for you. And after classifying, let us learn about each one of them in detail. First is the bacterial group. In the bacterial group, we have tuberculosis and lupus vulgaris, syphilis, which is due to the spirochete, leprosy, and most important in this list is Rhinoscleroma. This is the bacterial group. Then in the next category we have fungal. In fungal group we have rhinosporidiosis, which is very important. Rhinosporidiosis. What are the other fungal conditions that you know? Aspergillosis, mucormycosis. Mucormycosis is very important in immunocompromised patients. Okay. Histoplasmosis, blastomycosis, and finally candidiasis. These are all in the fungal variety. After that, we have some unspecified category. Some of them are idiopathic. Some of them fall under miscellaneous conditions. But they are also important. Among them we have Wegener's granulomatosis. Wegener's granulomatosis destroys the entire septum, both the cartilaginous as well as the bony part. Non-healing granuloma. And finally, sarcoidosis. This is the broad classification of granulomatous diseases of the nose. Now let us learn about all of them one by one, beginning with the bacterial variety. Among bacterial granulomatous diseases, the first and most important one that we are going to learn about is Rhinoscleroma. Rhinoscleroma. Rhinoscleroma is caused by a gram-negative bacillus known as Klebsiella rhinoscleromatis. Now this has another nickname and that is called as Frust bacillus. Both of them mean the same, Klebsiella rhinoscleromatis or Frust bacillus. This is the causative organism of rhinoscleroma. Now this rhinoscleroma is endemic in many parts of India, especially in the North India more than South India. This disease, rhinoscleroma, starts in the nose and then it extends into the nasopharynx, larynx and goes all the way up to the bronchi via the trachea. Okay, so it extends from the nose till the bronchi. And there are 3 stages in this disease. The first stage is known as atrophic stage, and this stage resembles atrophic rhinitis, about which we have studied. What are the most important features of atrophic rhinitis? Foul smelling nasal discharge and nasal crusting. Those 2 features are seen here also. What are they? There is foul smelling purulent nasal discharge. Along with that, there is crust formation. These are the 2 most important features seen in atrophic stage. And after atrophic stage, the next stage is granulomatous stage. In the granulomatous stage, we find granulomatous nodules have formed. Swelling can be seen in the nose. Nodules or swelling. And where are these seen? In the lower part of external nose and also in the upper lip. There is subdermal infiltration. Subdermal infiltration in the external nose as well as upper lip. These nodules are painless and also they do not ulcerate. Now, ulceration is a common feature in all other granulomatous diseases, but here there is no ulceration. So, please remember that. The nodules are painless, plus there is no ulceration. And there is a particular description called as woody nose that is given here. Because of all the nodules, the nose feels woody. Woody nose is used to describe the second stage of rhinoscleroma. These nodules coalesce together to form granulomas. And sometimes it is so severe that this woody nose looks like zebra nose. What is a zebra? It is an animal. It is a cross between a horse and a zebra. Horse plus zebra, it is a zebra. If you look at a picture of zebra, you can see it has a characteristic type of nose. And that type of nose is seen in these patients. There is thickening of the skin and the nose becomes very broad. So woody nose and hebra nose are seen in granulomatous stage. As I told you, there is no ulcerative stage. So the next stage would be cicatricial stage. This is the stage of healing and scarring. So what happens in cicatricial stage is fibrous tissue forms, scarring occurs. But this is not just normal scarring, there is contraction of the scar tissue leading to stenosis, and adhesions are formed in this stage. So because of extensive fibrosis, the features that are seen are vestibular stenosis, and even stricture formation is observed. As this disease extends from the nose all the way down, you can see stricture formation at various levels, such as a nasopharyngeal stricture is possible, or even at larynx this can occur. Laryngeal strictures, laryngeal stenosis can occur. Stenosis can occur anywhere in this entire tract where rhinoscleroma can occur. Okay, and the nose in this stage has another specific name called as tapir nose. T-A-P-I-R, tapir nose. The external nose gets all the more deformed. In granulomatous stage itself, it was deformed, and now because of all the stenosis and all, it becomes all the more deformed, and it is called as tapir nose. The deformed nose is called as tapir nose. Now let us look into the etiopathogenesis of this disease. You already know the causative organism, and that is Klebsiella rhinoscleromatis. It is a gram-negative Coccobacillus. And what is the mode of spread? It is airborne spread. It's an airborne infection. Usually, people in the 2nd to 3rd decade, young people are affected. 2nd to 3rd decade of life. And females are more affected than males. It is more seen in low socio-economic strata, probably because of poor nutrition or poor hygienic conditions. Coming to the pathology, you have already studied about the 4 stages. Exact histological features, let us see. In the histological features, you will see that there is abundance of inflammatory cells such as eosinophils, lymphocytes and plasma cells. But the most important feature is the presence of large foam cells that are called as mucosa cells. Large foam cells. Okay. What are these large foam cells? Because of the engulfment of bacteria by macrophages, the macrophages will become foam cells. Okay, and these are called as mucosa cells. And the mucosa cells contain the bacilli inside them. The first bacillus or Klebsiella rhinoscleroma is present inside the foam cell. And also, there are characteristic cells called as Russell bodies. These Russell bodies are vacuolated cytoplasm with nucleoli. These 2 features are very, very important in the histopathology of rhinoscleroma. And also you will find the bacillus inside the mucosa cells. Clinical features you already know, that depends upon the stage of the disease. If it is the first stage, you will find nasal discharge, nose block, repeat, you will find nasal discharge, nose block, crusting, and then in the second stage, granulomatous stage, we will find nodules, swellings, granulomas, deformity of the nose, and finally in cicatrization stage, there is stenosis. What are the possible complications? This disease can spread to all the surrounding structures of the respiratory tract. It can even extend into the sinuses. repeat. It can even extend into the paranasal sinuses and spread. It can go into the lymph nodes and lymph vessels and cause blockade of the lymphatic system. It can metastasize into bones also. Okay, so these are various complications. Diagnosis is by taking a histopathological specimen, a biopsy, and observing it under the microscope. The bacteria can also be cultured and identified, isolated. Coming to the treatment part of this disease, because it is a bacterial condition, an antibiotic course is necessary. Prolonged antibiotic course. And what are the antibiotics that we can use? Some of them are tetracycline, or amoxicillin or streptomycin, all of them can be used. They are used usually for a period of 8 weeks, 6 weeks to 8 weeks. This is very important. Tetracycline is the drug of choice. And in some cases, even ciprofloxacin and rifampicin have been used if it is resistant to tetracycline. And after taking 2 consecutive cultures and observing that the biopsy specimen is negative, only then the treatment is stopped. Until then, the treatment is continued. And to reduce the acute inflammatory reaction, even steroids can be used. To prevent further changes such as the deformities, cicatrization and all the granulomas, steroids are helpful. If at all the patient presents to you after stenosis has already occurred, then nothing can be done medically. A reconstruction surgery has to be planned later on. After complete resolution of the disease, then a nasal reconstruction surgery can be planned to correct the deformity and to improve the airway of the patient. Nasal reconstruction surgery. This is done later on. So this is all about Rhinoscleroma. Let us learn about the other infective bacterial granulomatous diseases in the next video. Thank you very much and have a nice day. The cross between a horse and a zebra is a hebra. And the hebra has a very characteristic nose, and that type of nose with hardening and thickening of the skin, broadening of the nose is seen in granulomatous stage of Rhinoscleroma. Let us move on to the next stage, which is called as cicatricial stage. In the cicatricial stage, there is healing and scar formation by fibrous tissue. But there is contraction of the fibrous tissue, which is called as cicatrization, that leads to stenosis, narrowing, and also stricture formation. Adhesions and strictures and stenosis are the main characteristic features of this stage. So in cicatricial stage, what is the main feature? It is fibrosis. And you find vestibular stenosis, narrowing of the external nares, and then stricture formation that can occur anywhere, nasopharyngeal strictures. Hebra nose is a characteristic feature seen in nodular stage or granulomatous stage of Rhinoscleroma. After this, let us move on to the third stage, that is cicatricial stage. In the cicatricial stage, healing occurs by scar formation. There is fibrous tissue formation. But this healing undergoes contraction and this leads to stenosis in the nose and also further deformities. So what are the main features of cicatricial stage? There is fibrous tissue formation. Along with that, we find vestibular stenosis, narrowing of the external nares, strictures are formed, nasopharyngeal strictures, and even laryngeal stenosis could occur, as this disease is extending right from the nose up to the bronchi. Nose, nasopharynx, larynx, all of them can get involved. So these strictures, repeat. So these are the features seen in the cicatricial stage of Rhinoscleroma. These are the three stages. First is the atrophic stage, then is the granulomatous stage, and finally cicatricial stage. In the cicatricial stage, there is a characteristic type of nose that is seen called as tapir nose. Just like how Hebra nose is seen in granulomatous stage, here what we find is a tapir nose because of all the stenosis that has occurred. And the clinical features depend upon the stage of the disease. Now with this, after understanding the three stages, let us now look into the etiopathogenesis of Rhinoscleroma. Etiology, you already know, it's caused by gram-negative coccobacillus known as Klebsiella rhinoscleromatis, also known as first bacillus. It is a gram-negative coccobacillus. What is the mode of transmission of Rhinoscleroma? It is via airborne route. Inhalation of the infected droplets or exposure to contaminated tissue leads to Rhinoscleroma. Young people, usually in the 2nd to 3rd decades of life, are affected with this disease. 2nd to 3rd decades. And females are more affected than males. There is female preponderance. After understanding the etiopathogenesis, now let us look at the histological features of Rhinoscleroma. These histological features are also useful in the diagnosis of the disease. We will find abundant plasma cells, lymphocytes and eosinophils in the submucosal layer. But most important histopathological feature is the presence of Michelix cells. What are Michelix cells? The macrophages try to engulf the bacilli, the bacteria, into them, and later on they become foamy, and these foamy macrophages are called as Michelix cells. This is a characteristic feature of Rhinoscleroma, and because of these cells, Rhinoscleroma is also called as Michelix disease. Apart from Michelix cells, another important feature is Russell bodies. These Russell bodies contain vacuolated cytoplasm. Vacuolated cytoplasm with nucleoli. Let me show you a picture of the histopathology. As you can see in this picture, there are foamy cells, which are the Michelix cells. Can you appreciate them? Foamy macrophages all over. Now, after histopathology, clinical features you already know that depend upon the stage of the disease. There is purulent nasal discharge, nose blockade in the first stage, that is atrophic stage, and then there is swelling, nodules, and externally you can see the deformity of the nose as in granulomatous stage, and finally in cicatricial stage there is stenosis and narrowing of all the structures. So clinical features depend upon the stage of the disease. Coming to diagnosis, it is a clinical diagnosis mostly. As I told you, the disease is endemic, so doctors in those areas usually identify these cases very well. Apart from that, you can take a histopathological specimen, send it for biopsy and look at the Michelix cells containing macrophages and bacilli inside them. plus also Russell bodies and identify Mikulicz disease. Now finally, let us move on to the treatment part. Because this is an infective condition, the first and most important treatment consists of antibiotics. A prolonged course of antibiotics for about 6 to 8 weeks is usually given. And what are the drugs that are used? Tetracycline is the drug of choice. Along with tetracycline, some other drugs can also be used, such as streptomycin, amoxicillin, or rifampicin and ciprofloxacin have also been used. This is when it's not possible to use tetracycline, or there is resistance to tetracycline, then we can use any of these drugs. Now, when to stop the treatment? Not exactly after 6 to 8 weeks. What you have to do is, we have to again take a specimen, and only when the cultures are negative, when we look at the biopsy and it is negative for 2 consecutive cultures, then we stop the treatment. Because it's quite a resistant organism and it's important to completely treat the disease. And to control the inflammatory process, steroids are used so that the disease progress is kept in check to prevent the complications and deformities of the external nose that occur. In case the patient presents to you after stenosis or at the stage of cicatrization, then a nasal reconstruction surgery can be planned. Later on, after complete resolution of the disease only, this nasal reconstruction surgery is done. After a few months, it is done to improve the airway and also to correct the external deformities. So this is about the treatment of rhinoscleroma, and the last part, coming to complications. The disease spreads into various structures. It can also go into the paranasal sinuses and affect them. It spreads into the lymphatics and causes blockage of the lymphatic system. Bones are extensively involved, and sometimes metastasis can occur, although it is very, very rare. Okay, so complications are involvement of other structures. So more commonly involved structures are the paranasal sinuses, surrounding bones, and lymph nodes and vessels. Lymph nodes and lymph vessels. So this is about rhinoscleroma. I hope it's all clear to you, all the 3 stages, clinical features, diagnosis and treatment. Let us learn about the other bacterial granulomatous conditions in the next video. Thank you very much. Have a nice day.